As a cardiologist for a number of decades, I've treated many individuals with congestive heart failure. And as many of you may be aware, there are many different causes of congestive heart failure. What many of you may not be aware of is that one of those particular causes is pregnancy. We're going to deal with a patient who presented to us after about, say, 30 to 40 years of having pregnancy-induced congestive heart failure. She was very symptomatic, very volume overloaded, and very sick on numerous medications. Stay tuned and see what happens. Welcome back to Montgomery Heart and Wellness, and we have another clinical rounds for you. And we're talking about a 61-year-old lady who had pregnancy-induced heart failure.
Yes.
Interesting.
Yes.
So tell all, and you manage this patient primarily, so why don't you kind of do how she presented with chief complaint and everything?
So yes, she presented to our office shortly after being discharged from a hospital for fluid overload. And her history consisted of peripartum cardiomyopathy, of which at the time after giving birth, she was treated medically for a few months and never really followed up with a cardiologist. She also has history of former tobacco use and some inflammation markers as well. So when she came to our clinic, she was still actually fluid overloaded a little bit, and she had bloating, abdominal fullness and swelling from liver congestion secondary to heart failure. She had leg edema, so she had pitting edema in her legs, and trouble breathing when lying down, which we call orthopnea. So what had happened was, when I was interviewing her, figuring out why did she decompensate recently, versus all these 30 years time, she had, in the last several years, went on a keto diet, and we know that that can really trigger inflammation in the heart and the blood vessels and the kidneys. And she was under a lot of stress, moving and not getting good sleep. So I think all of that together just finally took a toll on her body and made her decompensate.
Yeah, she had been hospitalized prior to coming in, and she had been on the keto diet up until then, wasn't she?
Yeah.
Okay, gotcha.
She had went on it to lose weight, but it ultimately triggered more inflammation and fluid retention and weight gain.
Oh, wow.
So,
There you go.
which was sad. But so in addition to that history, she had severe mitral valve regurgitation. Her ejection fraction, or the pumping of the heart, was only 10%.
Oh, wow.
So she had a life vest on, because that can reduce risk of sudden death when the ejection fraction is less than 35%.
And that's a temporary defibrillator.
Temporary external defibrillator. What we also found was that she had an elevated liver enzyme, which was another form of evidence of liver congestion, liver inflammation from the heart failure. She had a lot of early heartbeats on her heart monitor, and then we put her on particular therapy. So her treatment was...
So this was the only therapeutic approach, right?
Right,
Or
this
the
was
only
it.
additional therapeutic approach.
Correct,
Right.
because she didn't live here, so we'd see her once a month, but do a lot of phone call check-ins, and it was a raw plant-based diet, and she would do a 32-ounce green juice and then 2 raw salads, and the dressings would have some healthy fats like seeds, nuts, or avocados. But a very strict diet for over 90 days with the intermittent fasting, because that also allows the body to heal faster.
And I like to use the term precise as opposed to strict, but either way, it's fine.
Okay.
That's okay.
Some other things she would have benefited from if she could have come for it would be like the ozone in the form of EBU, the sauna, Beamer therapies, but she wasn't able to do those.
And these may be options in the future, and that's how some of these adjunct therapies help out with the nutrition.
Right. So again, she did this raw diet for over 90 days. So patients who are more critical condition, we put them on a raw plant detox for a longer period of time. They have more improvement to be done. So we looked at over time reduction in inflammatory markers. So One marker we check is called myeloperoxidase. So that looks at inflammation in the arteries, and that had gone down significantly multiple times. So initially we checked it in August and it was at a level of 561. Normal is less than 470. So in September it went down to 347, so normal. But then we still checked it again, it went down to 262. So just going down really nicely.
So major reduction in inflammation.
Correct. She also had less stress on the myocardium, or less stress on the heart muscle and heart tissue. One way we check that in the blood work is by a peptide or hormone called NT-proBNP. So we had checked this 4 different times, and in August it started at 7,613, and it gradually went down. So in December it was at 3,199.
This is impressive, yeah.
We also measured the cardiac output, and she had significantly improved cardiac output. So remember, initially that ejection fraction was 10, and then when we rechecked it after about 3 months, it went up to 25%. Now, it's still low. We still have more work to do because, again, she's actually been dealing this for many, many years and not really known it. But it doubled, and that was amazing. She also had reduced liver congestion. So one of her liver enzymes, ALT, was high at 44, and it gradually went down to 25. A good range is 6 to 29. So all these factors correlate with improvement in symptoms, because she wasn't having the early satiety. She wasn't having the bloating anymore. That's signs of improved liver function.
And again, it's an indirect, the improved liver function is a sign of improved heart function, because of impaired liver function and the bloating, probably edema inside her GI tract. All these things are signs that the heart is circulating better, it's pumping better, and circulation is improving. And so, this is really impressive, just given the nutritional aspect of this, because it's very hard to get this on medications. If not impossible in some cases, but yeah.
Yeah, it is very hard and rare to see that improvement with just medication.
Now, this is something that's after my heart as an electrophysiologist. So you looked at the reduced number of ectopic beats, and what did you find?
So initially in August, just wearing a 4-day heart monitor, she had 430 PVCs, or premature ventricular contractions. When we rechecked that in November, and she wore a heart monitor for almost 14 days, much longer period of time, she only had 59 PVCs. And then we also looked at the early beats coming from the top chambers of the heart, we call premature atrial contractions, and that went down from 203 to 169.
Really impressive. Now this, again, it's just one patient, 2 data points, so we can't draw any conclusions. However, this is very exciting in the sense that we're seeing a decrease in the amount of arrhythmias, and we know that people with heart failures are at risk for sudden cardiac arrest. So this may be a smoke signal, and it's something we would have to do in a formal study, with people with and without defibrillators, to see what happens to the risk of arrhythmia. But I think this is a very positive sign. We've seen this before in other patients, so really impressive.
She also had good weight loss, so she went from 144 pounds down to 130 pounds. She actually went down from, I think, about 5 medications, actually down to 0 medications.
Impressive.
And,
so impressive medication reduction. So in the summary of her outcome, what do we have to say? This is impressive.
It highlights the power of nutrition alone, really, to improve cardiac output, reduce inflammation, improve other organ function as well. And now she could really walk more, exercise more. She wasn't huffing and puffing going up the stairs, so she was feeling a lot better.
Another little comment I'll leave the audience with. Here's a patient with a very severe heart disease who, with her level of heart failure, will require frequent hospitalization. Many cardiologists would refer her to an advanced heart failure team where she would go through a lot of procedures. She may have an LVAD place. She'd spend a lot of time in the hospital on a lot of different medication procedures. What she did by being very precise with her nutritional regimen, she then took on ownership and was empowered to improve her overall health condition. And she's not taking medications now compared to having to take 5 before. And in addition to that, she's feeling better, she's at home, and she's more empowered. And so that's really important. That's the other dimension that's there. Now, we have more work to do, but this is really impressive and you did a great job.
Yeah,
So,
she did great.
so this is wonderful. As always, I'm always excited to talk with these patients. I hope you gain a lot from this. As always, leave your questions and comments in a comment box. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.